Hello, everybody, to the sixth installment of the Transform Education series, where we help you transform your practice, patients, and healthcare by adding functional medicine services based on how your patients are adapting to stress. I'm your host, Pete Wisniewski, and our group of world-class educators are excited that so many of you are contributing feedback, watching the replays, and participating at our events. In case you missed any of these sessions, you can easily find the replays and notes to follow along at transformwellness.org. I want to take a moment to thank everyone who has been spreading the word about this series and sharing with friends and colleagues. You'll be glad to know that we have hundreds of new doctors registering every month, and if you are new, thanks for joining us and enjoy the content. Today, Dr. Ronda Nelson is joining us once again for her second webinar in the series entitled 6 Physical Clues for Thyroid Evaluation, where she will help us quickly assess a thyroid case using visual clues and blood lab tests. It should be clear that Dr. Nelson is drawing on her extensive training and professional experience in providing these amazing sessions on thyroid stress. Based in Redding, California, with a second clinic in Seattle, Washington, Dr. Nelson has gained the respect of patients and doctors alike. She is a dynamic speaker with a thriving practice, firmly rooted in the principles of functional endocrinology and lifestyle modification. She has seen and consulted with thousands of patients all over the world, dramatically improving health and well-being with diet, lifestyle, exercise, and supplement changes. I am grateful that she has been so generous with her time and resources to be with us here today and help us learn how to incorporate functional endocrinology into clinical practice. During this 30-minute webinar, feel free to participate in the polls and ask questions, and we will do our best to answer them at the end of the presentation. Now, please join me in giving Dr. Nelson a warm welcome in the chat window to the right.
Well, hello, this is Dr. Ronda Nelson. It's very great to be with you today. I'm excited about sharing the webinar that we're going to be talking about today. This one's on the 6 physical clues for thyroid evaluation. And if you're like me, you are noticing what I call the thyroid boom or the epidemic of these thyroid patients that are walking in the door. It's amazing to me how many thyroid patients that we're getting, whether they have Hashimoto's or not. Every patient is a thyroid patient almost. So I'm going to talk to you about how you can evaluate these very, very, very quickly by looking at the face. Because the patient comes in and they're told that they're fine. You're fine. Your blood tests look fine. Everything's fine. No problem. But yet they don't feel well. And that's a frustration, especially for women, because thyroid conditions are far more common in women than men. But they're frustrated because they know they don't feel good, but yet their doctor's telling them with the TSH only that they're fine. And we're going to be talking about blood markers next month in next month's webinar. But today we're just going to focus on the physical signs. So when I was doing a little bit of research just recently, the only thing that I could find that I could really pin down was they said about 12% of the population will have some kind of thyroid disease during their lifetime. And I think clinically that number does not work for me because so many of the patients that I see have thyroid conditions. I think it's got to be much greater than that. I'm going to say clinically it's probably for me up around the 70 to 75% marker. So we have this epidemic of these thyroid cases that are coming in. We've got to know how to be able to identify them quickly if the patient only has a TSH, and then I'm going to teach you what we're going to do about them. So let's talk for a minute about iodine. Iodine deficiency is the most common reason for thyroid disorders in this country, I believe. When the patient is iodine deficient, you're going to end up with hypothyroid or goiter. Now, goiter seems funny because as we're going to look at shortly, the goiter, when you see a goiter, it's a swollen area around the neck. But it really is an iodine deficiency. That's what will resolve the goiter. Some countries in South America and other even third world countries where the iodine deficiency is rampant, they'll have goiters as high as 80% of the population. We don't see that here, but I think if we give it enough time, we will see it because we don't have enough iodine in our diets. So in the 1940s, there was a study that every medical doctor is going to refer to, and it was known as the Wolff-Chaikoff study, since known and referred to as the Wolff-Chaikoff effect. And basically, what they did during the study was they used imaging. They were using rats, and they wanted to see at what point the thyroid became saturated with iodine. So they were using iodide, as it were, and that's the form of iodine that the thyroid prefers. And they were using iodide, and what they found was that the thyroid stopped taking in iodine at 200 micrograms. So they assumed or inferred that anything over 200 micrograms would cause hypothyroidism. And that wasn't true. It was just that for those rats, they didn't need more than that. The thyroid just didn't need more than that right then, but that doesn't mean that the thyroid doesn't have an amount of whole gland sufficiency or a whole glandular amount that the thyroid needs. It just didn't need that much right then. You can't hammer a thyroid with 5 milligrams of iodine. It can't get in. It's just like if I put something on my skin, it takes a little while for it to absorb into the skin. I can't just put a cup of water on my skin and expect it's going to absorb. I can't throw a bunch of iodine in the body and expect it's going to go up quickly. It just takes time for that iodine or iodide to be able to get into the thyroid. And there's some other factors as well that weren't addressed in the study. So the end of the day is that it was a very bogus study, much like the cholesterol studies that were done by Ansel Keys. And it was just believed then that, high cholesterol or eggs would contribute to high cholesterol. And that's not true. This is the same idea. It's just a falsified study that met a perfect environment and everyone just believed it. So many of the medical doctors that talk about iodine usage call this medical iodophobia, which is just the medical fear of using iodine. Women in Asia, however, ingest about 12 to 13 milligrams, not micrograms, milligrams of iodine every day and have no evidence of hypothyroidism or goiter. So you can see that there's a huge disparity between 200 micrograms and 12 or 13 milligrams of iodine intake, yet the premise in the US because of the Wolff-Chaikoff effect is false, and then we see actual Asian women over here having more and not having any difficulty. So we have a true, what I believe, an iodine deficiency at epidemic levels in our country. So if we're going to use a blood test, that's all we've got to be able to assess this. Iodine testing is best done using a urine loading test, but for the average patient that goes to their doctor, they're not going to get that test. So the patients we see are the ones that have a test already. It's a TSH or TSH and a T4 maybe. If you have an up-and-coming doctor, they're going to order 2 markers rather than just the one. So the patient has a belief system in these blood tests. They believe that they're concrete. This is my blood test. This is the gold standard. When they come in with the TSH, you're not going to be able to see anything. However, at the end of the webinar today, I'll give you the list of the blood tests that need to be ordered, and then next month we're going to talk about them in greater detail. But if you have all of the tests in line, you're able to reorder these tests for the patient, not just use the TSH, but you get all of the blood tests. This is what we're going to be able to see. You're going to be able to see whether there's an iodine deficiency or suspected iodine deficiency, I should say, based on this thorough panel of blood tests, which we'll talk about. We're going to be able to see how well their T4 is converting to T3. If there's excessive stress that's causing the problem, we'll be able to look at those antibodies to see if there's Hashimoto's or Graves' disease. This is not something that the medical doctors are looking for because medically the treatment is still the same. If the patient has Hashimoto's, then the doctor's not going to do anything different than give them Synthroid or levothyroxine, some kind of synthetic hormone replacement, because it doesn't really matter. If you've got autoimmune thyroid disease, their opinion is that you're going to need replacement thyroid hormones anyway. So that doesn't matter. But for me, clinically, I'm going to do what I can to support that autoimmune condition and see if I can get that to stop and then reverse. We can also see if there's any kind of cellular resistance to the hormone. Hair analysis is a great way to look at that, but we can see it on a blood test. And then finally, we can see if there's thyroid hormone interference happening with excess or imbalance levels of some of the other steroid hormones. And this is by looking at the binding proteins that transport these thyroid hormones around in the bloodstream. So, where are we going to start? Let's look first at their face. Let's look at these physical indicators, and there are several of them that you can see below the head and neck, but I just concentrated on the face, the up above the shoulders. So, if you can see the face, you can get a really good idea as to what's happening with that patient and their thyroid. As well, I always recommend that you take pictures because picture is worth a thousand words, right? So if you take a picture when the patient comes in, make sure that the picture is well able to discern very specific features about the face, the head, and the neck because you'll use those pictures as a before so that you can compare them to the after because otherwise you're going to miss some of these changes. So always take pictures of your thyroid patients, always. So let's start. Here are the 6 most common symptoms of thyroid dysfunction. We're going to start talking about them. And again, one more reminder, just make sure that you get a good picture. The first thing we're going to do is we're going to assess the hair. The hair will tell you a lot about thyroid conditions in a lot of women. You want to look for hair that's thin or dry. It can be kind of sparse. You can, what I call see-through hair. It'll be dull. It can even be a little unruly, like it just kind of wants to go everywhere. So I will often ask the patient if they have difficulty with their hair or they're experiencing hair loss later on during my appointment with them. But initially, I'm just taking all of this visual information in. I'm not asking, I'm not pointing it out. Because women, too, when you begin to point out things, oh, you have this and you have this, don't do that because women are very self-conscious and then they're going to think that they're walking around like a billboard and everybody's going to see that they have a thyroid problem. We don't want to point it out. These are just things for you and I to be able to look at as we initially just assess visually what's going on with the patient. But if I have to, I'll ask them about the thickness of their hair. Did it used to be thicker? Do you notice texture changes, thickness changes, etc.? But you also might want to look for loose hair on their clothing, a blouse, a top, a jacket, even their pants. Look to see if you notice that there's some loose hair laying around because that'll give you also another visual indicator that something's going on, that they are losing hair. This is what this can look like. You can see this hair that it's very thin, very thin. This is what I call see-through hair. And this can be for several reasons. We might have a elevated DHT. This can also cause this type of pattern of thinning. But you can also see in a brush. You know, we look at excessive hair loss in a brush, and I'll ask them, does an excessive amount of hair come out when you brush or comb your hair? So but initially, just look at the hair. See if it looks dry, unruly, coarse, thin, sparse, that kind of thing. The second thing we want to look at is what's going on around the eyes and the face. There are 2 clues that you can look at around the eyes. Now, the first one is one that we all know, and that is that loss of the outer third of the eyebrow. But this one's going to be a little harder for you to ascertain when the patient's sitting in front of you because we women want to paint in or use an eyebrow pencil to color in or to fill in that missing part of the eyebrow. So this one's going to be a little bit harder for you to find. You don't want to stare at their eyebrows because then you're looking at somewhere other than their eyes. So just glance. If you don't see that it's missing, then keep looking because you'll find some other signs. The other thing you'll see is periorbital swelling or even edema. Sometimes the whole face can look swollen. So let's take a look here at this orbital edema. You can see that the woman on the left, she's got more of a you can see her gray hair, but do you see the bags that are under her eyes? And as well, her face looks just very swollen. The woman on the right, this is the crop shot, she has a lot of swelling around the eyes, although she's smiling, which is nice to see. But she has a lot of swelling under the eyes. Now, I'm not saying this can only be thyroid. I'm just saying that you have to put all of this into a clinical bag. You have to create the clinical case about your patient. We could have kidney issues. This is also a marker for kidney dysfunction or kidney fluid retention. But my point is that we do have fluid that's accumulating in the facial tissue as well. The young woman here, you can see that her face looks fairly swollen. She looks swollen in her cheeks, between the cheek and the jawline. She's quite swollen, and you can see that for her, the swelling it's fuller above the eye. She has a little bit below the eye, but it's more above the eye. So looking at the face, you want to look for eyebrow loss, that outer third of the eyebrow, but then you also want to look at eyes, around the eyes, that periorbital swelling or just general facial edema. What's happening with that fluid in their face? Now let's move on to their skin. So again, we're looking at the face here because I said face and neck. So we're looking at the skin in the face area. But often when thyroid function is decreased, circulation will decrease. This reduces the amount of blood supply to the skin over time, and what will happen is the skin will become dry. It can even become very coarse and look like alligator type skin, but you're not going to see that on the face. You're going to just see generally dry skin. I sometimes will even, this is not the above the shoulders, but I sometimes will take a peek at their hands because their hands are always going to be exposed, and then their forearms as well. You'll often see it there. So you can see that the skin just looks dry. It just looks dry and flaky. This is a result of reduced circulation or hypothyroidism. Hands will often become kind of cracked and dry, needing a lot of lotion. And then sometimes even around the eyes, I'll see dryness. They'll have dry areas just under the eye, near the corner of the eye. Sometimes it's in the outer eye, but it's almost always around the eye area. It'll be a little bit more dry. But you know, women, before they go out, they're going to just cake on the creams, right? They're just going to put a bunch of lotions and creams and they're going to try and cover that up. So it might be something that you're going to want to ask about. Now let's move on to the neck. I think the neck is the most fascinating part. I love looking at necks. And I find myself, I'm not careful when I'm looking at patients, I'll stare at their neck because I really love looking at necks. You can tell so much about what's going on with a person from their neck. So the first thing that we're going to look for is swelling or increased fluid or swelling that's looking like it's happening in the neck. You might even see that there might be redness. Look very carefully for red areas, maybe to the left or the right or central, or you can even see it down on the clavicle. You can see it down in the crease of the neck, that lower first rib clavicle area. You can see that redness will sit down in there. So you want to watch because that might indicate increased vascular activity in the area. So the most common things that you're going to see are these double lines. Now, most of the time, you'll see that the lines will look, if you look in the mirror and you look at your own neck, and when I teach seminars, I often will say, okay, look at the person next to you. Let's see if we can flush out some thyroid patients in here. And, 60-70% of the room will have thyroid issues in their neck. But when you look, you want to look for those double creases, double lines. They'll connect left or right. They're going to be continuous. If you see someone and the line doesn't connect in the middle, that's not what I'm talking about. As you can see in the picture, it's a double line. It looks like someone's put two rubber bands around their neck and the skin has creased above and below where the swelling is within the gland. This is what we're looking for. So you can see in the pictures that I've put in here, some of these even have 3 creases. So there's a lot of swelling and compensation that's happening in the neck. You'll see that often in a woman who has a longer neck. She'll often have 3 creases, but in all of these pictures, you can even see the swelling that's occurring, and that's why the neck has got these creases, because it's swelling. There's swelling going on, and the skin is actually beginning to fold around the upper and lower part of the thyroid. So one of the young women in the black shirt with the blue suspenders, you can see that she's got a lot of swelling. That thyroid has really, really enlarged. So you can see the 2 lines that are above the neck, and then you see that larger area right there, kind of where her hair folds, and then it looks very swollen in that lower area. The thyroid sits low at the notch. It's just above that. In her, it sits quite low, but you can see that the swelling has really radiated up and out to the left and the right. This is called a goiter. Now, a goiter is caused by a lack of iodine. You can see a goiter with or without Hashimoto's disease. It doesn't matter. But if the patient has a goiter, they are hypothyroid. It can be very subtle. So when you take photos of your patients, and again, I cannot stress this enough, take pictures of their face. We do on every patient. Always take a lateral view, because you may not see the swelling from the front, from the anterior view, but you can see it from the side. So I take it from the left and the right as well. But if there's an iodine deficiency, it's not about just giving iodine. And don't be afraid of iodine, but we need to make sure, that especially when we're talking about the thyroid, and I get into this more in the online thyroid course that I have. It's called Mastering the Thyroid, and you'll see a little bit more about that in a minute. But I get into this very deeply in the online thyroid course about how to use these nutrients and what part of the cycle of this utilization of iodine these nutrients are needed. Now, selenium is probably the most important nutrient. We can get selenium from Brazil nuts, garlic. Astragalus has some selenium in it. Cataplex E, which is a standard process product that I like to use. Some of these different nutrients, I want to get the selenium from food. So some of these nutrients may be synthetic based nutrients, and I'd rather not use the selenium from that source. I'd like to get it in its whole complex. I want to get it in the food form. So I'd like to use an herb or food where I can. Zinc and magnesium are also very important because these are nutrients that the thyroid needs in order to create and use iodine in the thyroid to build thyroid hormones. Now, there are several types of goiters. On this drawing, the drawing on the left is a normal thyroid. You can see then the second drawing, going left to right, is where we're seeing just that swelling that's starting to happen. As it continues and continues, the thyroid gland can become kind of fibrous. Now, interesting that iodine is used for any fibrous anything, fibromyalgia, fibrocystic breasts, a fibrous thyroid. Iodine is what's needed to be able to settle down, calm down, and resolve that excess fibrous accumulation or fibrous tissue. So the thyroid is telling us exactly what nutrient it needs by forming this fibrous type growth on and around the thyroid. And then the last type of goiter there is more of a cystic goiter. And that's where the thyroid really has become so dysfunctional, so deficient, that the thyroid is beginning to form cysts. And we have to deal with that a little bit differently. However, if you look at the photos of these two women, look at the one woman, she's in here again with this larger band, but around her neck, where you can see that swelling that's radiating up to the left and the right. The other woman, you can notice that she's got some redness on her neck. Do you see that? So we know that there's increased vascular supply, and look at that nice, wonderful goiter that's right there in the middle of her neck. I don't mean it's wonderful for her, but I love looking at them because they really are so easy to fix. You just need to provide some of those base nutrients and some iodine, and those goiters will go away very, very quickly. So sometimes you'll get those nodules, even where we've got this one woman who, on the one side of her neck, she's got a very prominent swelling. Very often, that thyroid will just get hot on one side. You'll have one side that'll get dysfunctional, and the other side is perfectly fine. And then another young woman here in the photo, you can see that she's got more of a fibrous thyroid. Do you see how big and full that is? She really has got some iodine issues in there, iodine and the subsequent nutrients as well. I wanted to give you a view of a pre and post picture. So this woman is in her mid 70s, and you can see she's one that we referred to earlier with the periorbital swelling. Look at what her picture looks like after she's had appropriate thyroid intervention. Look at the difference. This is the exact same woman. Look at the difference. You would never have suspected that there was that much swelling in her face. Look at how much her eyes have calmed down. Her eyes are much more open. They're bright. Even the blue in her eyes is brighter. The picture on the left shows that she's got that darker, hazier, it's like the lights are on but nobody's home. The picture on the right, her eyes are they're bright. You can see the reflection on her of the light on her eyes. Her lips aren't even as swollen. Do you see the difference in her lips? So you would never have thought that by looking at that initial picture. But the result of thyroid intervention and thyroid support, when you get those right nutrients in there and you get that iodine in there, as well as the other things you've got to do, the results are dramatic. So let's take a look to finish up. What are the 6 thyroid indicators? The visible physical clues that you can get right away. So you always start with the head and face. We want to look for dry, coarse, sparse hair. Something's going on with their hair. We want to look at that outer third of the eyebrows, but remember, some women may pencil or color them in, so that may not be as instantly visually obvious to you. But hair is a quick one, and then look for that facial swelling. I hope that the pictures that we had in the webinar are enough to kind of tweak your mind to have you be thinking about this or looking at these faces that you're going to see in a little bit of a different way, like looking at the lips. And then look on the face for dry skin. This one, again, is going to be a little bit harder to tell because they'll put lots of lotions and creams. But if it's truly dry, you will see it. And then on the neck, we will look for those double lines, those neck rings, and then swelling, as we might know, would be a goiter. And then we want to look for these parallel lines or this nice goiter that will show up. And this woman, you can see that there are multiple creases, multiple lines, and these are the creases that are formed in the initial stages of the goiter. But as the goiter or the swelling becomes more and more, it gets bigger and bigger and bigger, and that inflammation and swelling that happens in there, she's now having to adapt or create additional compensation, I guess as it were, around that swollen goiter. So now you're going to start to see she looks like she's got rings on a tree in her neck. This is just a progressive, gives you an idea of the progressiveness of the goiter or the iodine deficiency. And iodine with some selenium will work to recover this. It does get a little bit bumpy for these patients because, as you know, the iodine is part of the halogen family. And the halogens are bromine, chlorine, and fluorine. When you begin giving iodine, along with selenium, whatever your source of selenium is that you choose, when you begin giving iodine, it's going to be bumping out or knocking out some of these other halogens. When that happens, the patient may not feel good. And often they'll incorrectly blame it on the iodine. Oh, I can't use iodine because every time I take iodine, I don't feel well. Well, no, you probably don't feel well, but the reason that you don't feel well is because you're bumping out those other halogens. So it's very important to go slow with iodine. It's not a race. We just go really slow. You go to give the patient what they can tolerate so that they don't feel crummy, and then keep increasing from there. So next month, when we do the follow-up webinar to this, we're going to talk about these tests right here. These are the tests that you want to use or want to order on every thyroid patient that you can. The CBC is important. That's going to give us information about possible anemia, maybe any kind of parasitic infections. The Comprehensive Metabolic Panel, or a CMP, the patients will often come in with, but this gives us additional information about digestion, about their mineral status, sodium, potassium, etc. And then the rest of the markers on the page, the TSH, total and free T4, total and free T3. I like to get a reverse T3, a T3 uptake, and then both of the thyroid antibodies, the TPO and the TGB. Those thyroid tests are going to give us a very complete picture about what's happening within the thyroid. And again, if you would like more information about the Mastering the Thyroid course at wellbodyinstitute.com, please feel free to visit, and you can use a discount code TW $50, and that will give you $50 off of the course when you purchase it there at the Well Body Institute.
I'm going to interject and thank Dr. Nelson for that great presentation. Love the pictures and thorough explanation. Let me take a moment to once again explain your course. I want everybody to join Dr. Nelson in Mastering the Thyroid at wellbodyinstitute.com. Become the thyroid leader and build your functional medicine practice. It would literally take years of going to weekend seminars to learn all the information packed into this course. Learn the physiology, biochemistry, practice management, and diet, whole food supplements, and herbs that you will need to quickly resolve cases and build a massive client list. Once again, utilize the TW $50 to receive a special rate, only good for registered attendees of this webinar series. I want everyone to keep in mind that Dr. Nelson offers one-on-one private instruction and support for your challenging patients. You can schedule a time with our office at 530-245-0880. Once again, that's 530-245-0880. 245-0880. And before we get into the questions, please take a minute to note down some upcoming webinars by Dr. Bill Hemmer, Dr. Annette Schipple, and Dr. Ronda Nelson as we continue our look into practice management, blood sugar, and thyroid stress. Next up on Tuesday, September 29th, Dr. Bill Hemmer continues his series on practice management principles with his next webinar on the secrets to staff-run wellness programs. In this webinar, he shares his experience with his pain clinic, breaking through his mental blocks to scale his functional wellness practice utilizing staff and systems. Join us for a very frank and open session so that you can think about how you can transform your practice and make real, measurable differences in revenues and your patients' lives. Now let's take a moment and turn it back over to Dr. Nelson to answer some of these questions. Welcome back, Dr. Nelson.